All right, let's talk about a piece of tech that is completely changing the game in healthcare. I'm talking about the continuous glucose monitor, or CGM. Today, we're going to pull back the curtain and see not just how these things work, but how they're actually built from scratch. Let's dive in.
Okay, I want you to just think about this number for a second. 90 million. That's how many adults in India are currently living with diabetes. It's the second largest population in the entire world. So you can see this isn't just a statistic, right? It's a huge healthcare challenge, and it's crying out for some serious innovation.
And a massive part of that challenge? It's the cost. Right now, an imported CGM can set you back almost 10,000 rupees every single month. The big idea here is to build a homegrown version that brings that price down to around 2,000. And look, this isn't just about making something cheaper. It's about breaking down a huge wall that keeps this life-saving tech away from millions of people who desperately need it. So, how do these things actually work? You might think it's some kind of magic, but it's really a beautifully designed system. It's got three main parts that all work together perfectly to take a reading from just under your skin and, well, pop it right up on your phone screen. Okay, let's meet the team. First up, you've got the sensor patch. This is the disposable part you wear on your body. Then you've got the transmitter. That's the reusable electronic brain that just snaps right onto the sensor. And finally, of course, the smartphone app. That's your command center, where you see all your data. Simple, right? But each piece is absolutely critical. All right, let's follow the journey of a single glucose reading. It all starts with this super tiny, flexible filament that sits just under your skin, sampling the fluid there. Now, on that filament, there's a special enzyme coating. Think of it like a little chemical factory. It reacts with the glucose in that fluid and creates a teeny tiny electrical signal. The transmitter then reads that signal, zaps it over to your phone using Bluetooth, and boom, a number pops up on your screen. It's pretty amazing. And the real hero in that little factory? It's an enzyme called glucose oxidase, or GOX for short. This stuff is the absolute key, the chemical engine that makes the whole thing work. And we're not talking about some new, unproven science here. GOX is the reliable, industry-standard workhorse. It's the same chemistry that powers the most trusted CGMs all over the world. So that's the how it works part. But what about the how it's built part? Now we get to dive into the actual engineering blueprint. And let me tell you, building a medical wearable from scratch requires an incredible amount of precision to make sure it's not just powerful, but also completely safe. You see that little sensor filament? It's a total marvel of material science. It's not just a piece of wire. Oh no, it's actually a stack of super specialized layers. The best way to think about it is like a high-tech sandwich. You've got a biocompatible layer so it's safe for your body. Then there's a gatekeeper layer to control exactly how much glucose gets to the enzyme. Then you have the enzyme layer itself, the factory. And on top of that, a really important interference-blocking layer, which filters out false signals from common stuff like pain relievers. Okay, what about the brain of the operation? The transmitter. Inside this little reusable pod, you've got the main processor and the Bluetooth radio. That's what does all the thinking and the talking to your phone. There's also this incredibly sensitive circuit, an AFE, that can measure the electrical currents from the sensor. And we're talking about currents so small, they're measured in nanoamps. And the craziest part? The whole thing is powered by a tiny coin cell battery that's engineered to last for over a year. Incredible. So you build the hardware, you get the software working, you're done, right? Not even close. Getting a device like this approved for patients is a whole other ballgame. See, this isn't a fitness tracker you just sell online. It's a proper medical device. And that means it has to survive a long, really demanding journey of rigorous testing and validation. And just take a look at how long that journey is. We're talking about a 4-year process. From the first idea to actually launching the product, you've got research, prototyping, endless lab testing, and then the big one, human clinical trials. And all of that has to happen before you can even think about submitting it for regulatory approval. So in that whole long process, where's the budget going? Well, over half of it, a whopping 55%, goes directly to those human clinical trials. This is the make or break moment. It's where the device has to prove, without a doubt, that it's safe and accurate in the real world with real people. It is by far the most expensive part of the journey, but it's also the most important. Okay, so how do you even measure accuracy for something like this? Well, the gold standard is a metric called MARD. It stands for mean absolute relative difference, but what it really means is pretty simple. It's a percentage that tells you how close the CGM's reading is to a super accurate lab quality blood test. The best way to think of it is like a golf score. The lower the marred number, the better the accuracy. Simple as that. All right, so after all that incredible engineering, all those years of rigorous testing, what's it all for? What's the end goal? It all circles back to one thing: real-world impact. It's about taking this incredible, life-changing technology and finally making it accessible to everyone who needs it. And listen, the impact here is so much bigger than just the price tag. We're talking about a device that's actually made in India, an app that supports more than 9 Indian languages, and something that's been designed from day one to plug right into the national health stack. This is a solution built for India by India. I mean, just let this sink in for a moment. A 75 to 80% reduction in cost. That is absolutely massive. That is the kind of impact you can have when you build a solution specifically for the people you're trying to help. This isn't just a number. It's a number that could completely change the day-to-day reality for millions of people managing their diabetes. And that really brings us to the big takeaway here, because this isn't just about one device, is it? It makes you step back and ask a much bigger question. What does the future of healthcare even look like when game-changing technology like this stops being a luxury for the few and becomes something that's truly accessible to everyone?
This is seriously groundbreaking work, and its potential for impact is just enormous. If you want to learn more or maybe even get involved, you should definitely reach out to Neodocs. The email is anurag.meena@neodocs.in. Thanks so much for tuning in.